So today we will be discussing the topic selection and the literature review in medical research, that how you will select the topic, how you will work on your topic, and how you will select the topic, and then how you will work on the literature review in any type of medical research. So let's study the importance of topic selection. First of all, we will study the importance of the topic selection in the research. Like we discussed it earlier, that a selection of topic is very important for any type of research, and we will use different criterias. You might be well aware of these details. And then we will discuss that why literature review is the foundation of your study, and our objective is to learn that how to select a research topic and review the relevant literature efficiently, effectively. So in this, our focus is on two major things. First one is the topic selection, and the second thing is literature review. So first of all, why topic selection matters? Anyone can ask that question, that why topic selection matters. So basically, the topic selection discuss or set the direction of your research, that in which direction your research will be going. If you are conducting a meta-analysis, then you can't do a cross-sectional study in that particular meta-analysis. If you are doing a original research, you can't use any other parameter which is not supposed to be used in the original research. So basically, the topic selection give direction to your research, that you are working on that particular thing, and these will be the outcomes. And even from the topic you can get information that what type of research will be this. Either it is going to be a cross-sectional study, or the molecular study, or qualitative study, or quantitative study. And it also affects the study design, the feasibility, and the publication potential. You have to give the related topic to the research, then it will get easily published. You have to look at the feasibility, and your research topic will discuss the feasibility and the study design. For example, it also helps to maintain motivation and focus, and the selection of a good topic will definitely motivate you to work further on that particular idea, or that particular topic. So for example, choosing the prevalence of hepatitis B in dental students versus just hepatitis B. So these both are topics. These both can be titles, but just look at the first title and look at the second title. From the first title, the prevalence of hepatitis B in dental student, let's say, is a complete topic that you have a study design. You can easily assume that this study is about the prevalence, so it will might be cross-sectional study or questionnaire based study. And it's and if you choose the second topic, hepatitis B, it's very broad topic, and you can't work on this thing because hepatitis B have hundreds of thousands of different dimensions, and you can study from any dimension. So let's say if you choose the topic prevalence of hepatitis B in dental student, it's a very clear topic, and from that topic you can easily find out the future and the feasibility, and even the study design and the publication potential of that article, that particular study. That if this topic is well suited, well adjusted, and it can easily be published. If it's a good title, it's a good topic, then you can easily work on that topic and further publish this article in future. So this is very important because the title or the topic selection matters. We are discussing these things that you might get a general idea about the topic selection and all these things. And at the end of this lectures, at the end of this internship course, we will be then working on. We will be work. Please don't use these markers or all these things on research or during the lecture. This disrupt us, and definitely it's not a good thing. So please don't use these type of things. Okay. Now the next thing is that what are the characteristics of a good research topic? So we have already, you might have listened about or studied about that F.I.N.E.R criteria. You have to use F.I.N.E.R criteria, and the research topic which you want to work on should be feasible, should be interesting, and must be novel, ethical, and relevant. So these are the parameters. You have to look at these parameters while selection of any research topic. If you want to conduct a very good research, if you want to work on a good research topic, you have to use the F.I.N.E.R criteria, which means feasible. The research should be feasible, and the research should be able to be completed in a feasible time and easily completed. And the second thing, it must be interesting. To the researcher and to the scientific community, your research title must be interesting and try to get a novel topic. Try to explore the aspects or the area which is not currently that much explored. And then it must be ethical. It should fall under all the ethical consideration, and you should obtain all the ethical considerations for that particular topic. It should be relevant to to your goals, to your career, to your field of study. Let's say take this as an example, that role of d-dimer in predicting the COVID-19 severity is feasible and relevant if you look at this topic. But if you select that COVID-19 severity, so it's very vague or broad topic, so you will not be able to work on that thing. And now there is a question that I want to select a topic, and how should I do this? What will make me able to select a good research topic? So these are the sources of research ideas: clinical rounds and case discussions. You are an HO or TMO and you are working in some hospital, or you are just a final year student who is attending different wards and for his or her studies. Then you can easily work on that thing, and you can find out that or you can easily work on different research ideas. You can easily observe the type of diseases that are more prevalent in that particular area. Then you can easily work on that thing. Second thing is that while choosing selection topic or while working on research topic, you have to keep in mind the public health issues like dengue outbreaks or malaria outbreaks in summer. We usually have seen these things that in this time in the summer, usually the dengue, malaria, or all these outbreaks are very severe, and usually people get affected with these things. So you have to look at the public health issues as well. From there you can easily get topics. If some public health issue is more prevalent in your vicinity or in your village, in your area, then you can easily choose that particular topic to work on. Then the textbooks and journal articles can also help you with that. If you study different textbooks and different journals article, if you are a researcher and studying article on a routine base, you study different journals articles, then from that journals articles you can easily get the research ideas. And in journal and any research article, if you look at the conclusions portion, there will be a research gap mentioned in that topic that we have done that work, and the future work may look at these parameters, look at these aspects. Then from that conclusion section of any article, you can easily get research ideas and then further work on these ideas. And then the supervisors, mentors, and the previous thesis will also help you to work or to search research, to get sources for research ideas or to select a research topic. If you discuss your research with your supervisor, or you can easily discuss your ideas with supervisor, mentors, or you can even look at the previous thesis and get an idea from that previous thesis. For example, the rising antibiotic resistance in urinary tract infection at your teaching hospital from where you are teaching, or at your in your village. Let's say if you are from Peshawar or Lahore or somewhere else, you can use that particular thing. So basically, the more public health issue, the more you focus on the public health issue, the more you focus on the hot topics of the recent days, on the issues of the recent days, on the disease and outbreaks of the current time, the more it will be easy for you to get a research topic and to select a beautiful research or a well suited and novel research idea. So it's very important to work on all these parameters, to work on all these aspects. And now the next thing is that how to narrow down a topic. If you have selected a topic and you want to work on some particular topic, and you have chosen a broad topic, that let's say you want to work on anemia, you want to work on anemia, then you have to start from broad and then narrow down the topic using PICO. You can use PICO question, PICO details, like what P means patient or the problem on which you are working, and I means in the interventions which you want to. For example, you want to compare the different parameters or different drugs, and you give this is the intervention, that the thing which you apply on that particular is in the intervention, and then the comparison and outcome. These are the parameters that will help you to narrow down your topic. For example, you have to compare IV versus oral iron in anemic pregnant women, and you want to study the outcomes of that particular that particular oral iron supplements, and then you compare the IV versus oral. So your patient is pregnant women, the intervention is iron, and the comparison is that of IV versus oral, and the outcome, you will get the outcome after that particular research. So your research title will definitely explain all the parameters in on which you are working, and it must explain the all parameters. If you are working on some particular research, then it must be capable, that particular title must be capable to explain everything. If you tell something, that someone that you are working on that particular title and he or she is a researcher, then they must be able to find out that what type of parameters or intervention or comparison or sources you are using. So you have to narrow down the topic after the broad selection. And then there are common mistakes which we use or which we make in the selection of the topic. So the topic is usually too broad or too vague. You can't narrow down your topic too much, or you can't use too broad topics. So you have to be in the midway between the broad and the too narrow down topic. And then irrelevant to the local population. If something is irrelevant to the local population, then it's not important. For example, if someone is conducting study on the worms which spread due to the eating of some food that is not allowed in our country, that is not that is not allowed in the religion or in that particular area. So it's not important, because if something is not utilized, then how it can spread disease. So basically you have to look at this thing, and you can't choose the topic which is irrelevant to that local population. You have to, just like we I told you earlier, that you have to look at the topic, you have to choose the topic which is more relevant. And the third mistake is that no available data or resources. There is a specifically some sort of new disease, and you want to conduct study on that particular disease, and there is no data available or no resources available on that particular disease. So it's not a good topic, or it's not a good title. You have to choose the topic on which relevant data is available and resources are available. And the next thing is or ambitious for student level. If you are or ambitious, it will also hurt you, it will also give you setback. So you have to be ambitious but not or ambitious. And then ignoring the ethical limitation. You can't conduct some study which does not fall under the ethical considerations, and uh, which is not ethically correct, or ethically that particular study is not ethically approved. So you can't ignore that thing. You have to keep in mind these things. And then, for example, if we choose a topic that cancer treatment outcomes in the worldwide, so it's too broad, and thousand, if not millions, thousands of articles will be present on that particular cancer space treatments in different particular areas. So you cannot compare, or you cannot use or study the whole world for that particular disease. So you have to not to be get or ambitious, and do not choose the too broad or vague topic, and do not exclude the local population. And if no data is available or resources available on that particular topic, don't go for that particular topic. And don't be over ambitious at student level, and do not ignore, never ever ignore the ethical limitations. You have to first of all work on the ethical considerations, the ethical limitations, then move towards the topic. Then the topic finalization about the topic. If you want to finalize the topic, then there are still several parameters that you should work on. First of all is the conduct. You have to conduct a preliminary research or literature review. And then you have to conduct the preliminary literature search, and gather data, that either available resources or data is available on that particular topic. If sufficient data is not available, change your title or your topic. And then discuss with your supervisor or the mentor, and get help from that mentor or supervisor related to that topic, or that disease, or that study you want to conduct. So you have to take that details, and discuss it properly with your supervisor. Then you have to check the hospital access to the data, that either you can get data. If you, for example, if you want to work on malaria prevalence, then you have to check that can you get data of malaria from HMC or some other hospital in Peshawar. or at some other area, some other locality. So you have to look at these things. You have to check the access to the data from the hospital, and then consider the ethical implications that either this study is ethically proved or this study is ethically good, and then ensure the manageable that this is manageable within the timeline and budget. So you have to make sure that the study you are working on or the title you are working on will be manageable within the timeline, and the budget you have available is more than enough for that particular study to be conducted easily. So these are the things you have to keep in mind while finalizing the topic. You have to conduct a preliminary literature research about that particular topic to for what purpose? To find out that yes, sufficient data is present on that topic and I can easily work on that particular topic, and then discuss with the supervisor. And if after discussion with your supervisor or mentor, this thing will help you to identify the possible narrow down the topic and to work on some proper topic. So you have to discuss it with the supervisor and then check the hospital access to the data, that either you can easily get data from the hospital or from the patients, and then also consider the ethical implications. If your study is not supported by the ethical committee, then all your hard work will be in vain and all your hard work will be wasted. So you have to make sure that it is ethically correct and I can easily publish that particular study after conduction, and it's ethically good, and you have to ensure that it can be easily completed within the timeline and the budget. So the next thing of today's lecture is the literature review. So what is literature review? If you look at the literature review, it's basically a summary and critical evaluation of the existing research. You are the critical summary of previously published research. So why we do the literature review, why we study the previous articles or the previous research is basically it helps us to identify gaps in the current knowledge, and it also informs your research question and methodology. Literature review will help you to make your research questions and methodology easily, and it will find you help you to identify the research gaps in the current knowledge, and then you will be able to design your study on that particular research gap. So that's why the literature review is very compulsory, and the purpose of literature review is to understand that what is already known, to find out that how much work has been done on that particular research or that particular topic, and also to avoid the duplication of the research, so that if some study is already conducted and I just duplicate that study, so that will not be that much good type of study, or it may not be get accepted at different levels. So you have to avoid the duplication of research and understand that what is already known, and to build your study rationally, to build your study questions, research question. Then you have to build your theoretical framework, and after the theoretical framework, it will also help you to justify your study. The literature which you study will help you to justify your study, to justify your results, and also justify the sample, the research design, and the analysis plan. And you can easily write down in your literature review that previously a sample size of, let's say, 1000 people were used, and study design was cross sectional, and analysis was chi-square and t-test. So you can use that things in your own research as well. So that's why the literature review is very compulsory and very important in the understanding of what is already known, and to avoid the duplication of the research, to build your own research question or research rationally, and then to build your theoretical framework, and also to justify your study at the introduction level, and then in the discussions you can easily justify your study and justify the sample design and the analysis plan. So for all these things, literature review is very important, and previous knowledge is very important to know about the previous knowledge or the literature review. And then there are certain sources for literature review which you can use. First of all is the PubMed, which PubMed usually index all medical journals, and you can easily get topic on any related art field from that PubMed, and from that you can easily do conduct your literature review. Then Google Scholar, which is broader but includes gray literature. It includes different type of studies which may not be present in the PubMed. So you have to use the Google Scholar. You can get literature or previously published articles related to some topic from that particular website. Then you can also use the HEC digital library. I guess most of you will be aware about the HEC Digital Library. From HEC Digital Library, you can easily access the local thesis or the local research that has been done on some specific field or disease or particular condition, and then the institutional dissertation or thesis that are available whenever someone completes their studies, they submit one copy to the institute for future use, and you can easily study that previously published or previously completed researches from your institution library. You can easily study that articles and then work on these things. So these are the sources, and these are the main sources for the literature review, which you can use and get data from on different fields and on different topics from that particular databases. And then if you are studying and if you are searching literature, so there are keywords and Boolean operators. So you can use that Boolean operator, which is and, that narrows down the topic. If you what I mean if you give if you search for vitamin D deficiency and preeclampsia, so this will narrow down the topic and narrow down the search to the vitamin D deficiency and the cause of that particular disease. And then OR, these are the different gates which you can use on different softwares or in the PubMed. uh, OR gate or OR operator will expand the result, and if you study that malaria or malaria like condition or plasmodium, so you will get all the study that have been under this particular titles. For example, if we study different titles and if you search different literature under OR operator and even not operator, you can even use not operator that excludes study. For example, you can use that prevalence and hepatitis B and dental student, not HIV. So all prevalence study related to hepatitis B in the dental student will be appeared, and all the prevalence study related to HIV in the dental student will not be appear in that particular search. You can use synonyms and mesh terms, and you can use different filters in your, Google Scholar or ResearchGate or any other PubMed or any other website or database. Like you can use filters of year, full text, human language, and all these things will help you to properly work on the literature review and to select or to find out the more related titles or more related data. And then the next thing is the organization of the literature, or the organizing the literature. How you can organize the literature if you are using different softwares like Zotero, EndNote, and Mendeley, on which we will be giving you a live session on how to use this app, and we will be teaching you all these things in the upcoming lectures. So if you are using these things, you can also use that particular software. You can also make a table of author, the year of publication, the objectives and the methods and the key findings, and this will help you to clearly explain your problem and then easily work on that particular problem. So how to write a literature review? What will be the structure of the literature review? First of all, you can define the scope of that particular disease or particular problem, and in the main body, you can group by themes, methods, or chronology, and then in the conclusion, you can identify the gap or justify your research that prior research has been talked about these things, have discussed that parameters, but these parameters were not explained, and now I am going to explain that parameter in that identifier or these gaps which I identified in my previous research or in the previous literature. So I'm going to answer these gaps, and I'm going to fill these gaps and find answer to that particular gaps and to contribute to the scientific community. So it's very important to identify the gap and justify your research. So how you can write a quality literature review? First of all, you have to summarize and synthesize. Don't just list studies, you have to summarize and synthesize and work on these things and critique methodologies and the outcomes. You have to be critical in the methodologies and outcome regard, and then do not just copy things, do not just copy that literature. You can use that, you can paraphrase that literature, and after paraphrasing, you proper always cite the sources and use the consistent style. Either you want to use the APA style or Harvard or any other style. So you can use any type of the referencing style or the in-text citation styles, and we will be studying about different referencing styles and all these things in detail in the upcoming lectures. So how to write a quality literature review? First of all, summarize and synthesize, then be critical and paraphrase and cite. So these are very important while conducting any literature review. And how literature review connects to your proposal, and how you will connect the literature review to your proposal. And definitely the literature review will help you frame your research question, and it helps you to design your research questions. It helps you to frame your research question, particular question, and it also helps you to strengthen your hypotheses, to work on your hypotheses, because from the literature you will be getting a lot of gap. You will be able to find out research gap, and that gap will be your research hypotheses, and it will, the previous literature will strengthen your hypotheses. And you can easily work on these things, that previous research has been conducted on these things, and these details are studied, as this gap is remaining, this gap is not yet studied, and I am going to hypothesize that thing, and I'm work on this hypothesis, and I'm going to answer this specific research gap, and then justify your methods and population. The literature review basically justify your methods and the population which you have selected. If you are selecting some particular age group, let's say you want to conduct some study in the age group of 10 to 20 years of age, and then the previous literature will justify your methods and the population, and it will also inform your discussion and the limitation. You will also be able to work on the discussions and the limitation of the study, to work on how this study is limited and how this research is limited due to certain things, and how you can work on the discussions, and how this your findings or your results are related to the previously published research. So you have to work on these things during the literature review. You have to collect the data, and then you will explain these things. So today's summary and homework is that you have to choose a medical research topic using the F.I.N.E.R criteria, which we discussed earlier, and then use PICO to refine it, and then also find 3 to 5 relevant study using PubMed, and then summarize their finding in a one-page matrix. So this is all you have to do today, and this is your homework. And I hope if you people worked on that thing, and then you will be able to work on any literature review and find and work on all these things easily. So this was all about today's lecture, and if you have any other question now, you can easily share with us.